My name is Benton. I'm here at the Center for Sports Medicine. I originally came to see Dr. Chrostowski as a recommendation from a rheumatologist who had rheumatoid arthritis, and back in 2012 I had actually wrecked my motorcycle, and I walked around on my ankle for about a year. Then when I went and saw my rheumatologist and kind of mentioned it to him and showed it to him, he personally referred me to Dr. Chrostowski, recommended him as, basically, in his words, was one of the best here in Chattanooga for ankles. Basically, I had torn all kinds of pieces up into the top of my ankle for that, and then just proceeded to walk on it made it worse. When I first came to see him, the timing of it was, going into, I work in the restaurant business, and the timing of it was was not good for me to be able to be out for surgery. So he was able to actually give me a orthopedic boot. It was kind of like just a flexible armor type thing. It worked really well, got me through the holidays at least. Then I came back to see him in the February. Went in. It was basically a triple ankle surgery. He had to cut in both sides, put in 4 staples across the top. They put a pin through the ankle or through the heel, kind of ground everything out, and basically cemented everything back together. The time that we were talking, one of the biggest things for me was I love riding motorcycles, and that was one of the things I did not want to lose. So in our discussions, he basically walked me through what would happen. It was very clear, very plain in his language. I didn't, I would lose my side-to-side mobility, but I could still move my foot up and down, which was, I need for my brakes from a motorcycle. So that was great. He did warn me ahead of time. Of course, it would not be an instant recovery. The process would take, 6 months to 12 months for the healing process for that. Not to expect to jump up and walk right away for that. I did commit to, as far as when I came in to the process, I had promised my wife that I would follow the doctor's orders specifically and exactly, which we did for that, and I'm very thankful for it because the results there have been fantastic. I stayed off my feet as long as he told me to. Told me to start trying to use it. So when I tried to use it, they prescribed a knee scooter for me, which is a whole lot better than trying to do crutches all the time. Once I came out of the boot, a lot of swelling for the first month or so. It just depends on, again, how much I was on my feet. The more I was up and about, the more swelling I'd have. When I asked him about it, he told me that was the normal expectations for that. Just told me to basically take breaks. If I was up for a few hours, make sure I sat down for a little bit. And just kind of up and down to kind of give it a reset, so to speak. When I get up and walk in the mornings now, it doesn't hurt, which is huge because it was to the point where when I'd stand up in the mornings, I literally could not stand up to start with. It'd take me 15, 20 minutes just to get out of the bed. Every interaction that I've had with the nursing staff, the desks, the McCauley location here for that, just everybody's just great. Their attitudes are fantastic. They're friendly. Got to know the nurse that I was working with that was taking off my cast, that I would see on a regular basis, stuff like that. Just kind of, she was running some kind of a half marathon with her son and stuff like that, and just getting to know them a little bit, which just made a really good experience there. It wasn't just a in and out and okay, you're the next patient type deal. It's been a great experience. I've enjoyed it. My wife has actually used Center for Sports Medicine before with Dr. Massey as well. She had hand surgery a few years back. Again, that was a great experience there as well. She enjoyed just how he communicated with her for that, and also as far as just the recovery and the physical therapy, her experience was good as well. So we've both enjoyed it. Definitely would recommend it. If I ever have any other issues again, it's probably where I'm going to come back to. So that's pretty much the story.